Hi, I'm Glenn Tobin, Chief Operating Officer of Cerner. At Cerner, our fundamental purpose is to help our clients, through the use of information technology, to transform how they deliver care. The program you're about to see is an exciting documentary about a breakthrough information system now operating at the University of Illinois at Chicago Medical Center. It's called Gemini. Gemini illustrates the far-reaching benefits that are available to healthcare providers today through the use of advanced information technologies. At Cerner, we call these benefits smart care. It's a term that describes how information systems are forever altering healthcare by dramatically improving both operational efficiencies and the quality of care. As you watch this presentation on how UIC Medical Center developed and deployed an enterprise-wide electronic medical record, consider how a similar smart care system could transform your organization.
The future of healthcare has arrived at one of the nation's busiest hospitals, the University of Illinois at Chicago Medical Center. It's called Smart Care. With 450 beds, 28 clinics, 400,000 outpatient visits a year, and a major teaching program, UIC Medical Center has been a leading provider of healthcare in Chicago for more than 100 years. By the mid-1990s, UIC Medical Center's administrators realized that new tools would be necessary to meet the healthcare demands of the next century. As a result, UIC Medical Center designed a vast new ambulatory care center. In that process, administrators committed to a paperless vision that included the use of an electronic medical record, which could store clinical charts on every medical center patient. The new electronic system would replace a decades-old paper system and eliminate major bottlenecks in the care process. With this new approach, charts would be accessible across the entire medical center system in both the outpatient and inpatient settings. So confident were they in this vision that the new center was designed with no space reserved for physical charts. Whether clinicians were seeing patients in the main medical center or in a primary care clinic 20 miles away, instant chart access, along with electronic ordering and improved real-time communication between departments, would help them work faster, safer, and more efficiently. To transform this bold vision into reality, UIC Medical Center turned to Cerner. Only Cerner's HNA Millennium architecture was capable of seamlessly linking the hospital's wide range of clinical settings through one information system. And only Cerner seemed genuinely committed to the idea at the core of smart care, a fundamental transformation of the healthcare system through advanced information technology.
We wanted someone who would partner with us, and that is something unique that Cerner brought to the table. That was probably the most important factor for us.
Known as the Gemini Project, UIC Medical Center's information upgrade proceeded in stages. Numerous hours were spent identifying the specific functionality required by clinicians in each of the medical center's care environments. In early 1999, Smart Care became a reality at the medical center when the Gemini system was turned on in the new ambulatory care center. 28 clinics were live. Soon after, UIC turned Gemini on in the hospital's 18 inpatient nursing units. Today, UIC Medical Center is reaping the benefits of its vision and effort. Clinicians are working more effectively. Costs are being reduced. Care is more consistent.
The key benefit of HNA Millennium for us has been easy access to information we need to make decisions as physicians. Prior to HNA Millennium, we had difficulty getting the information we needed to manage our patients. Now, information access is easy. We don't have to worry about lost records. Multiple physicians and other healthcare providers can access the same information simultaneously. The information is legible, it's well organized, it's in a format that makes it easy for us to make decisions. It saved us a tremendous amount of time tracking down results.
Gemini now contains up-to-date medical records on more than 2 million patients. Demographic and insurance data, personal and family medical history, lab, radiology and pathology reports, physician notes, test results, and outpatient visit records all can be entered or accessed with a click of a mouse from more than 2,800 personal computer desktops throughout the facility.
The main benefit of the Gemini system is that it's a lot faster. It's online. It's right there. It's user friendly. All the information that we need is available right there, and it's been very, very helpful as far as putting orders in and retrieving any kind of lab results, any results that we need.
Gemini's unprecedented level of automation has produced benefits in a wide range of areas. Communications have been improved between caregivers. Clinicians have more time for patient care. The task of searching for lost patient files has been virtually eliminated. Inpatient and outpatient care has become more integrated. Paper storage costs have been reduced. In general, productivity has been enhanced throughout the organization. For example, before installing Gemini, hospital officials estimated that a patient's paper record was not available when the patient arrived for care fully 40% of the time, and incomplete patient shadow charts existed in multiple facilities. Today, clinical records are accessible 100% of the time for physicians, nurses, and other clinicians working throughout the medical center.
To say that we were operating in very stressful and difficult times in terms of information and medical record management would be an understatement. We were completely paper-based, and our chart retrieval success to our ambulatory visits was, on a good day, perhaps 50%.
Smart Care has brought other gains. With the previous paper-based system, the average turnaround time before laboratory and radiology reports reached the physician was 3 days. With Gemini, diagnostic test results are available within seconds of being verified and are brought to the physician's attention through their desktop inbox. At the same time, the duplicate orders that often were triggered by delayed results have been virtually eliminated with the faster turnaround time and a system feature that checks for duplicate orders.
You know, it really used to take 3 weeks for radiology results to make it to clinics. And now it's a nanosecond. It's just astounding. But you know, patients win from that too. It's not just, a clinician is not the only one that benefits, because if you're undergoing diagnostic tests or you're concerned about a loved one and their information is available so quickly to the clinicians that getting back to you in 1 day becomes routine.
At the same time, Cerner's decision support expert systems, most notably those designed to prevent adverse drug events, are making care safer. Drawing from the patient's medical and medication record, as well as the Cerner Multum medication database, the software checks for and automatically alerts clinicians to possible drug allergy, and drug-food interactions. How effective is Smart Care? Ask the healthcare professionals at UIC Medical Center. Despite initial skepticism by some, usage levels of a MedCenter's electronic medical record are exceeding expectations, with more than 1,400 caregivers accessing the system daily.
Hey, that's the best thing that ever happened to us, you know. If you have all the information you need right in front of you, and yeah, you can have, first of all, we're dealing with lives over here in the air. And the faster you can get information to deal with these sick people over here, it's better. You can manage the patient, a whole lot faster and better. The quality of care that we give to our patients over here is vastly improved with these information systems that we have right now.
The University of Illinois at Chicago Medical Center envisioned a healthcare information system that would help clinicians to work faster, safer, and smarter. With Cerner's help, they've made that vision a reality. In so doing, they've blazed a trail deep into the 21st century. Isn't it time your organization set a similar course for the future? Please contact Cerner today to find out what Smart Care can do for you.